Good afternoon, everyone. Happy Monday. It's been a very busy day so far. I want to welcome you to our COVID-19 update for December 21st. This will be our only update for the week due to the holiday falling later this week on Friday. And we will not hold an update on Thursday, Christmas Eve. If by chance we needed to, due to some large circumstance, we of course would, but as of right now, this is the only update we plan on providing this week. I want to thank Dr. Gail Burstein, you'll hear from very soon, and Kendra Schmidt from Deaf Access Services, who are here as always, or sometimes. Kendra's not always here, but Dr. Burstein and I have been here a lot lately. As we go through the update for December 21st, as of the 19th, there were 6,235 unique COVID-19 cases. 7-day positivity rate for the week before had dropped down to 6.0. It's one of the lowest rates we've had in quite some time. As I announced yesterday, we have a very sad number we had to add. We had another 60 individuals who perished as a result of COVID-19 and has now increased the total amount as of December 18th to 1,061 individuals in Erie County who have died. We'll go into a little bit more about that with mortality data. Hospitalizations as of December 19th, 473 COVID-19 patients in Western New York. 98 of those were in the ICU. So we're kind of where we have been in with regards to that number, with a little more than 20%. And then when it comes to Erie County, 391 patients in Erie County hospitals, 81 in the ICU. 55 had an airway assist. Unfortunately, on the 19th, 10 had died in the hospital. And we've also seen an increase in the ages, I should say, of the younger individuals who are hospitalized. 41% of all patients were age 64 and under on December 19th. So we have seen in the last few days an actually uptick in the number of people hospitalized who are younger than 64 or 64 and younger. Diagnostic testing summary for the last 6 weeks, we continue to see a drop. For the week that ended December 19th, the actual positivity rate for the week was 5.8%. We saw a drop again in total cases. We've basically done the same amount of tests for the last 3 weeks, but we've seen a drop in overall overall cases, as well as in the positivity rate, so that's a good thing. Had a 10% decline in new cases from the week ending December 12th to the 19th, and a 16% decline from the week of the 5th to the 12th. So this is a good sign. We're not out of the woods yet. We still see a lot of new COVID cases. We had over 3,000 new COVID cases for the week ending the 19th. That's a lot of cases considering where we were earlier in the year. But at least we're seeing a drop in the positivity rate, which means we're not spreading it to as many people as we were in the prior weeks. And then with regards to confirmed COVID-19 cases, the week ending December 19th by age and gender, you can see the bar graph here. With the males, the yellowish orange kind of color, and the females making up the blue color. And you can see in most of the age categories, you have, well, it's kind of depending on the age category. Some of them it's roughly same, some where males are more, some where females are more. But we do see that big, tallest line is the 20 to 29 age category, and it just shows that the vast majority of the cases in recent periods, we've seen a lot of growth in the 20 to 29 and 30 to 39 age category. And that is very disheartening, because we know those are individuals that are working and could pass it on to others, their parents, their coworkers. So we do see, unfortunately, continued growth in the younger age categories with new cases. And then COVID cases by zip code, week ending December 19th. The raw data shows that the 14221 zip code once again had the most cases, but you will note it's under 200. 172. It's the first week in a while where the highest zip code area did not have over 200 cases. And there are some interesting statistics here that show that some of the same areas that we've had cases in the past are still showing large cases, like the 14086 zip code in Lancaster, or 14224 in West Seneca, 14225 Cheektowaga, Tonawanda, Hamburg. So we have seen the same areas that have had a lot of cases in the past still have the most raw cases. I will note, you see Alden jumped up there and has one of the highest population rates, as well as a percentage of the 100,000 population. We are aware of a number of new cases in the last week or two coming from the Wendy Correctional Facility in Alden, the New York State facility there. And those are included in the Alden statistics, though they're not in the general population, of course. But we are worried anytime that there's increases in jails, not only for the jail population, but of course the employees there. So we're monitoring that and talking to the state about that issue as well. But the good thing to see in this chart is the new daily cases per 100,000 population on a 7-day rolling average has dropped, and the vast majority of them are now under 60, and there's not that many of them that are over 60. That is important because when we keep on dropping that number and we get to 25 or below, we actually have a much less chance of spread in the community. So we are glad to see that number on average for most zip codes drop. Just a quick comparison between Erie, Monroe, Onondaga, and Albany counties, the counties with the largest population base, so to speak, in upstate New York. And as we were the number one for quite some time in late October and November, we actually have dropped, and now on a 4-day or 7-day rolling average, Erie County is the lowest of those 4 counties. So when you compare Erie and Buffalo, Monroe and Rochester, Onondaga with Syracuse and Albany County and city, you will note that while we were number one for the while, we're number 4, and this is one of those races you want to come in last because you want to have the lowest positivity rate. So we have been trending for some time right now in a comparison to our fellow counties in upstate New York to have the lowest percentage, and hopefully we will continue that trend. And I hope that the other ones actually have lower trends too, because it's not good in some of these other counties and areas, especially the Finger Lakes region, which also includes, for those that are watching, because I know they live there and they can watch this, Wyoming, Genesee, Orleans County, parts of Monroe, parts of Livingston County can probably see this broadcast. So to our friends in the Finger Lakes region, Monroe County, we certainly wish you the best as you address what is a serious problem and actually having a higher rate of infection than we ever had. Erie County hospitalization, the 2-week chart, you can see it continue. We've had a little drop in the last week or so, which is good, though we haven't seen a huge drop with regards to ICUs as well as cases of individuals on an airway assist, and unfortunately we've had some of the highest numbers lately on a daily basis out of the hospitals with regards to deaths. On December 19th, 72.5% of all Erie County hospital beds were occupied. It's a better number than it had been. Still a lot of people are in the hospital. They're not all there for COVID-19, many of them there for other items. But 21% of the hospitalized patients were in the ICU, where we've been kind of recently for a while now. So 1 in 5 individuals who are hospitalized for COVID-19 are in the ICU, and unfortunately it's more than half of the individuals that are in the ICU who need an airway assist, and we know that that means they're in very critical care. Mortality data, 183 individuals unfortunately have died in the month of December from COVID-19, the average age being 79. Our Department of Health epidemiologist staff is still reviewing the data. For the new 60 cases, we wanted to get a little bit more idea on the timing, and it appears most of those were cases that fell between the date of December 12th through December 17th. So when you look at it, it's a 6-day period, 10 deaths a day. That's kind of what we've been averaging, not only between hospitalizations, but also issues associated with nursing home deaths. Some days you might have a combined 14, 15 deaths. Other days you may have a combined 8 deaths. But yeah, we've been averaging about 10 deaths a day as a result of COVID-19. And if we continue that trend for the remainder of the month, we will, in all likelihood, surpass the totals we had in April and May for deaths per month. And we know that more than half of these deaths were in congregate care settings, but not everybody was in a congregate care setting like a nursing home or an assisted living facility. Some people were living in their homes. Some people are younger ages that are out and working in our community that get very sick and unfortunately die. And we do believe that these are preventable by taking appropriate measures, wearing masks, avoiding larger social gatherings. So we're just asking everyone to continue that so we can once again keep this death total low. But if we were to continue with the number of days that we have left based on our analysis for the remainder of the month, and we average 10 deaths a day, we would all likelihood surpass the numbers we had earlier in the year, and that's a very sad fact. Once again, mortality data, whites are making up a greater percentage of deaths now than truthfully ever have during the COVID-19 crisis. Other racial categories, African Americans, Latinos, they're still at much lower numbers recently than they were earlier. That's a good thing, but we are seeing increased numbers of whites, such that 83.3% of all fatalities are white, and whites only make up 80.6% of our population. And when it comes to the city of Buffalo, the percentage of fatalities of the city of Buffalo has been 23.5%, while the population of the city of Buffalo for Erie County is basically 28%. So there's more people dying as a percentage of the population from outside the city of Buffalo in the suburbs, the two small cities, and the rural areas than our population. So all areas can and need to do better. Erie County responds. The Back to Business program continues to flow. You can still buy Shop 716 gift cards and give them to your loved ones, family members, others. But if you have a bonus card, you need to use it by December 30th. We're no longer doing the buy one, get one frees, but if you got a free bonus card from the what we did earlier in the year, you need to use it soon. Simple as that. You don't want to lose it. It's one of those use it or lose it. Well, you will lose it if you don't use it by December 30th, so please use it. And you can still buy Shop 716 e-gift cards. Go to amherst.org/shop716 to get a card. And I want to thank everybody who bought a card. There were 29,000 cards purchased with more than $1.1 million that'll be going into our local small businesses. And I'm going to turn it over to Dr. Burstein to go through a lot about remainder, including the vaccine and what we are doing with regards to vaccine delivery, including an important announcement with regards to the executive summary of our vaccine plan. Dr. Burstein.
Thank you. Good afternoon. So I know we're all so excited that our community is receiving immunizations at COVID-19 vaccines. So in Erie County, our health department, our public health preparedness are actively planning for a wide vaccine distribution in our community. We have actually posted our executive summary of our vaccination plan on our website, so please take a look at that. New on our website now for COVID-19 is a section on vaccinations. So we have information about our executive summary so people can just get a good overview and feel confident that we have a strong plan. And just remember that everything is changing very, very quickly. And so our plan, our final plan, is never going to be a final plan. It's always in draft form because we are always responding to new information, new situations that are arising. So we are always reevaluating and improving our plan. And then just one more reminder, I know I'm receiving a lot of calls and emails, and the health department in general, people asking, when will my category be up? When will I be able to be immunized? Because we have a lot of really important essential workers in our community and so many vulnerable individuals because of their age and because of other health status issues. So it's going to be a few months. It definitely will not be till next year and probably sometime in the spring and maybe later on this summer. I mean, right now it's not a plan problem. We have what we need to do it, just in terms of a plan and how to get organized. It's really a vaccine supply chain. As you know, right now there are only 2 immunizations that are authorized by FDA to use on an emergency basis, so we have a small supply and unfortunately a large demand. But we will get to everybody. We really want to make sure that everybody feels comfortable that you will get your immunization, and we're working hard to make that happen. The initial doses have gone out to the hospitals and the nursing homes, so not the health department, not the county health department. So we actually don't even have our own doses to immunize at all. So the hospitals are charged by the state to immunize, their most critical personnel that are working with COVID-19 positive patients in the emergency department, in the ICU, and on the COVID wards, and they're branching out to cover a wider distribution of their healthcare workers in the hospital. And then you may have already seen the governor's announcement that will increase the coverage of first responders and critical personnel. But again, it's a supply chain issue right now. We're waiting to receive the vaccines to the county, and the general community is going to be waiting. I mean, I'm waiting. Our county executive's waiting. We haven't been listed on a eligible category yet, so we all have to wait. So in the meantime, many of us are vulnerable to COVID-19 infection, so we still have to continue our protective behaviors, our safety behaviors by wearing masks, staying inside, socializing with just a group in your home, your close contacts that you're always with, not participating in larger gatherings, and socially distancing. However, we are, in terms of our planning stage, we are looking for people who are interested to immunize and work with us. So if you think that you may be interested in being a vaccinator, and you meet one of these categories, the governor has expanded the categories now in New York State of people who will be allowed to immunize for the COVID-19 vaccine. And so if you are in one of these categories professionally and are interested in working with us, please go to our Erie County Health Department vaccine website and fill out the form, and we are taking information. So I'm going to move on to testing. So the Erie County Health Department, we still have the same testing criteria, either people that are close contacts, so you should already be in quarantine. However, we would like you to get a test 5 to 7 days after your last exposure, regardless if you have symptoms or not, or people who are symptomatic, regardless if they're close contacts. So anybody has COVID symptoms. Again, we're seeing about 1 in 4 people who test in our rapid testing program for symptomatic people who are COVID-19 positive. So we're seeing a lot of people in our community with these typical symptoms, respiratory symptoms, any type of symptoms that are COVID-19 positive. So if you have any type of new symptoms, please isolate yourself and look to get a test. So to get a test from the county, you can call 858-2929 to schedule. These are appointment only, so if you don't have an appointment, we will have to turn you away. So please call us and make a plan. Also, we have our COVID-19 website with good testing information. We have a map that shows what facilities are offering testing and what type of tests are available. Now, you should make sure before you show up to these places, even if they don't require an appointment, what type of insurance they require, and then also to make sure that they report their data to the New York State Department of Health, so that we will be able to find you if you're positive and work with you for a case investigation. We've had a lot of problems with outbreaks in youth hockey sports recently. So our EPI team has identified multiple recent COVID-19 outbreaks among several different youth hockey teams. And I mean, people who are affected are not just the athletes and even very young athletes, but also the coaches and their families, the families of the players, the families of the coaches. So please, we're having these huge outbreaks in our youth hockey sports, and so please, people have to be careful. Their New York Forward does have specific regulations of what you are allowed to do inside hockey rinks, and one of the rules say that hockey teams are not allowed to participate in scrimmages, even if they're for practice or for pickup. Regardless, a scrimmage is a scrimmage, and those are not allowed because of the health risks. So in the health department, we are enforcing these. We know that we unfortunately went to one of our local hockey rinks, the Holiday rinks, and saw that there was a scrimmage taking place, and so we issued close orders. We're working with the owner to get his and review his his safety plan, and hopefully can reopen up. But just please, we want kids to be able to play and participate and be healthy. We just have to do it safely and follow the New York Forward guidelines. So, what we want people to do, again, it's the same whole, please, if you're sick, please stay at home. Avoid other in-person gatherings. The holidays are coming up. I know it's really tempting to go over your friend's house or your family's house that you usually do, but let's make it different this year. Also, please, we know that there is a lot of travel going on, and there is a lot of COVID-19 outside of New York State, and so please be careful. Think twice about taking that vacation to Florida or whatever you go to for your Christmas holiday. Also, if you do go out, please wear a mask and please socially distance and just keep yourselves and the people around you safe and healthy. And then also listen to your mother and wash your hands. So this is a slide just to remind us that the holiday season is upon us. And I know people usually like to spend the holiday with people that they love and that they, and that are really important to them. But this year, it's okay to take a pause and we can get off that merry-go-round of getting ready and having these big get-togethers and preparing all these food and gifts and cleaning our houses and just have like a quiet holiday get-together just with people in your own home. And, spend that time with people in your home. And, it's okay to say no and turn down an invitation. It's PC to do that now, just to make sure that you stay safe and healthy and that the people in the gathering where you might had been invited to stay safe and healthy. And then also, just a reminder, we know the holiday season is so stressful right now and, more so than ever. So please, take a break. Just check in with yourself, take the time to check in with your mental health, go outside and take a walk, just have some quiet time to yourself, remember deep breathing. There are some great hotlines out there, crisis services and other hotlines if you feel really stressed and need to talk to somebody. But really, I really want to encourage you, even though it's going to be cold, you can go outside and take a nice brisk walk and really, clear your thoughts and help you to relax. It is really helpful. I take a power walk every weekend day, so I just want to say it's really, really helpful. Just want to talk about our new hours of operation for our COVID-19 hotline. Remember, it's 858-2929. So we're going to be open during weekdays and answering phones and making appointments for COVID testing. Between 8 a.m. and 6 p.m. On Saturdays, we're open from 9 a.m. to 12 p.m. and Sundays we're closed. During the holidays, just to respect, people's need to go home and be with their families in their own home. We're going to be closing down our call center early on Christmas Eve and early on New Year's Eve at noon. And then we're going to be closed for the holidays on the 25th and on January 1st. So I'm going to leave it up to our county executive to finish us off.
Thank you, Doctor. Congratulations to our AFC's champion Buffalo Bills. The last time they were champions, I was in law school a long time ago. We want to congratulate the Pagula family, the entire organization. We know people are very excited, and we know people want to attend a football game at home for the playoffs. And as I've said, and as the governor said, it's really in the state's hands. And the governor has now put it in the hands of State Health Director or Health Commissioner Howard Zucker. We had previously said we believe we could get 10% of the population of the stadium in safely. And we still stand by that. However, for the time being, until we receive a notification otherwise, the games will still be off limits to fans. There is a chance, though, and the best way to have that happen is to keep our numbers down. It's as simple as that. If we can keep that positivity rate going down, then there's a greater chance that we'll actually be able to have fans in the stands. If people ask me today, is it going to happen? I don't know, but I am very happy and glad that we do have an AFC East championship to celebrate. Finally, this is the last time you will see from us this week, so we want to wish all those a Merry Christmas who celebrate. It has been a very difficult year, as the doctor noted. We hope that you will celebrate with your immediate family members, not go to larger gatherings. We have data from other areas of the country that show that larger gatherings from Thanksgiving caused big increases in COVID cases. We have actually had data that shows that people stayed home here. They didn't gather, and as a result, we did not get as large a spike as we feared and what they saw in other areas. So we're asking for the same with regards to Christmas. Please celebrate your Christmas safely with your family members, your immediate family members, to avoid those gatherings so that next year we can all be back again for Christmases, or as our friends in the Jewish faith already have celebrated Hanukkah, and then Kwanzaa coming up in the new year. It's a very, very important season, and we want all of our friends to be with us in the future. I unfortunately know a number of people who lost parents recently, and it is very, very sad to know that friends I've known for quite some time have lost their parents who've died from COVID-19. So to each and all, let's do our best to protect as many of our parents, our grandparents. The greatest generation is being lost as we speak. Let's do all we can to protect as many of our senior members of the community so that they can enjoy as many Christmases in the future going forward. With that, we will open it up to questions. Kendra can take a break for a minute, a few seconds. And we'll start with WKBW Channel 7. Is anyone there from them? If not, we will go to WIVB TV. I believe Chris Horvatis is on.
Hey, Mark. Dan Delbach is on and has a question, too. I'll start. In the past, I believe it was late September, you indicated if fans were to get into the stadium, the county would need something like 13, 14 days notice. Is that still the case? And if so, does that mean a decision on a potential wild card game, getting fans in there potentially, would have to be made by this coming weekend by the state?
In all likelihood, that's correct, Chris, because we need to have enough time to bring in the staff members associated with security, concessions, if they are going to have concessions. If they make a decision not to have concessions, it makes it a little easier, but you still have to have security staff. We still would have to ramp up our EMS staff. We basically have exceptionally limited EMS staff now, staff just to help in case there's an injury on the field, but of course you have to have increased EMS staff there when you have thousands of people in the facility. So yes, we would need to have an answer much sooner rather than later.
Why is it there's a limited EMS staff available right now?
Well, we don't have it fully staffed up as if we have a full stadium. It would be silly to have EMS there for 70,000 or 80,000 people when we literally have a couple hundred in the stadium right now. So we have a limited EMS staff. We'd have to bring folks in and get them scheduled from our normal EMS arrangements that we have. And right now they're just not there because there's no reason for it, with only having a couple hundred people in the entire facility as compared to what normally would have, in which truthfully it's a lot bigger operation than most people think. It's like running a small city for a normal game time, in which we have representatives from various agencies, security agencies, healthcare agencies, and the like, to ensure the safety of all the attendees. Move on, Channel 2, Steve Brown. Are you there, Stephen?
Yeah, I'm sorry. I had a malfunction on my end. Forgive me, I was away for a second. I had a three-part question, all bills related. One, as a public figure managing the response to COVID, I was curious what your thoughts were about the gathering Saturday night when the team was returning home. Also, in your conversations with New York State, how real do you assess the possibility of at least some fans in the stadium for the home game? And as COVID good behavior incentives go, how persuasive do you believe the Bills game with fans in the stand goes as trying to keep people to do the right things like wear masks and mind their distancing?
Well, for those who would attend the game, we'll start with the last question. It is certainly persuasive. For the vast majority of folks, we have to remember, we're talking about a region of 1.2 million, 1.3 million, and at most you're going to get 70,000 fans, many of them not from our region that normally would attend the game. You automatically lose all the fans who live in Canada, which is a substantial amount of fans. You more than likely would lose fans from other parts of New York State that come. So we're talking about a smaller percentage of individuals in our community anyway. I would hope it would be persuasive, but if they're going to go out and party, then that's certainly going to have an impact. And we were very disappointed about what we saw with regards to the mass gathering to welcome the team back. You know, it's good to welcome the team back, but if somebody in that crowd was sick and they passed it on to other individuals and only increased our rates, they're only hurting our opportunity to be able to actually get people in the stands. And what would happen if Josh Allen got COVID, or Tre'Davious White, or Devin Singletary, or any important player on the team? and they got COVID and they had to sit out a playoff game because they got COVID, we'd all feel pretty bad because we have an opportunity to control that. What percentage is that the state's going to make a change? I do not know. I can't answer that question. Remember, when we first talked about this, when we in the summer for games that would have been the beginning of the season in September, our positivity rates were lower then. And New York State didn't allow games back then. So we really have to drop our rate. To what? I don't know. Am I expecting fans to be in the stands? Probably not. Am I hopeful? Yes. But we control it with regards to the positivity rates. And if our positivity rates don't continue to go down, I find it hard to believe that the state would allow fans in the stands in January at positivity rates that are higher now than they were in September. Spectrum News, Aaron Ty.
Hi, Mark. I know Dr. Burstein touched on the holiday swing rinks a little bit earlier, but do you have any comments on it being shut down and what these hockey rinks need to do to avoid being shut down?
Well, part of the problem appears to be actual live cases that are occurring within multiple organizations. I know Dr. Burstein doesn't want to say it, but I will. We know of multiple cases associated with the Buffalo Regals organization based out of Holiday Twin Rinks. We are also monitoring and aware of multiple cases associated with the Southtown Stars, which play out of leisure rinks. And we are also aware of some cases associated with the Clarence Mustangs, who I think may play out of a rink now in Niagara County. And so when you see these multiple cases among organizations, it's concerning because you know that coaches sometimes coach multiple teams or parents have multiple children on multiple teams, different age groups. And there were multiple cases on multiple teams with the Buffalo Regals Association at Holiday Twin Rinks. So our health sanitarians went out. They saw conditions that they believed violated the state's rules. They shut them down. We do not want to keep the rinks closed. We want them open, and I know my understanding is the Holiday Twin Rinks owner is working with our Department of Health to prepare the proper response plan so we can open it up again. But I'm as somebody who coached hockey for a long time and has played hockey, haven't been on the ice in quite some time, gaining the fat to show it, but it's disappointing when I see some of my former fellow coaches say, you don't need to wear masks, and this is junk, who cares if the kids get sick? Well, sometimes the kids get very sick, but sometimes their parents get really sick. And it's important that the coaches understand and the parents understand that the best way to keep the kids on the ice, even if it's just practicing, is to follow the COVID guidelines. Nobody wants to shut down anything. I guarantee you that. No one wants to shut down any business, regardless of what it is. But when you see multiple cases, especially in an organization like the Regals, which is based out of Holiday Twin Rinks, it sends a message to us that there's maybe a problem that we've got to go check. And as the doctor noted, it doesn't take a whole lot for one or two people to spread it among an organization in a tight situation. We don't set the rules. New York State does. We do have to follow them. We do have to enforce them. And we're concerned when we see increased cases at a time when our overall caseload's going down. And that's, I think, another thing that's concerning is we didn't really see in the last couple months or so as many cases as we had early on. It's important. It's like the University of Buffalo men's basketball team is now taking a 2-week pause because of COVID-19 cases associated with the organization. It doesn't take a lot when you have youth sports or adult sports coming together, especially in locker rooms, hanging out, being able to spread COVID-19. And when you have organizations that are directly in the public and then they can go out there and be with their other family members or schools or teachers, it is very concerning. So it's a long answer, but we don't want to have to close down any other facility. We just want people to follow the rules as best as possible. Buffalo News. Anybody on from the Buffalo News?
Yes. Hi, Mark. It's Sandy Chan calling. I am interested to know if you have are there any other insights to be gleaned from the high numbers of deaths we're seeing other than the simple fact that we've got more hospitalizations, so we're going to have more deaths? I don't know if you've looked into the death numbers any further. to figure out why our numbers are continuing to be so high. And I'm also interested in your thoughts about Christmas, if you think that there is going to be greater temptation for families to gather with other extended family members and friends, and there might have been during Thanksgiving. When Thanksgiving, you're talking about at dinner. Christmas, the holiday season, that's when you're doing a lot of present exchanges. So I didn't know if that was of greater concern to you.
Starting with the second question, we are exceptionally concerned about Christmas, and not just because of family gatherings, but church. While the churches can be open, there are size restrictions on the amount of individuals they can have in a church. It's changed over time, but we know that individuals who probably haven't seen a whole lot of other folks may see them during a church service for Christmas or the family gatherings that can exist. When it comes to the deaths, it's just inevitable. When you have more cases, you're going to have more deaths. And we've been showing an average of more than 3,000 cases a week for the last 3 weeks. And it's sad to say, but some of those individuals who tested positive for the first time in this past week, we probably haven't seen any deaths from those yet. And if we do, it's going to be a couple to 3 weeks out after they become hospitalized, and after then they unfortunately become very ill. So when it comes to the deaths, it's all a matter of numbers. We know that there's greater spread in our community today than there was earlier in the year. It's as simple as that. And when you have more people that are catching it, you're going to have more deaths. We know that the rules with regards to nursing homes have been tightened to protect nursing home patients, but there are still COVID cases in nursing homes, and many of those are as a result of individuals, staff members who tested positive, and then, or who were, I shouldn't say tested positive, but who were positive and spread it in a facility. Even if you're testing a facility twice a week, there's still a chance that someone could catch it and then transmit it before they get the second test to show they're positive. So we are very concerned about that, and that's why we continue to ask everyone to do the best they can. And the other thing we're noticing too is while more than half of them are coming from congregate care locations, there's a sizable portion of people who are dying in Erie County at least, who are not living in a nursing home, who are not living in an assisted living facility. And that just goes to show that the community spread is impacting individuals who are well enough to live in their own home, because we've had too many of those deaths recently. And they're not all in their 80s. While the average age may be 79, not every individual who's passed in the last month or so is in their 80s. We've had people in their 50s who are living their best lives and unfortunately catch COVID and die. So it's painful to see the posts from people on social media that I know who've lost loved ones, and it just hurts to know that some of these deaths were probably preventable. Some of them had no fault of their own. They may have caught it in a congregate care setting, but we have to do better as a community to try to save as many people as possible. And for the Christmas season, we do not want to see, come mid-January, the increasing number of fatalities as a result of individuals who decided to come together for Christmas. It's just better off to wait. I'm not planning on doing Christmas gatherings with the family. I'm going to drop off gifts probably on my parents' back porch and just talk to them through the door, wish them a Merry Christmas, because I'd rather spend Christmas with them in 2021 and 2022 and onwards than potentially infect them and lose them. WBFO, is anybody on from BFO? If not, WBEN.
Hi, Mark. If there are fans that are allowed into the stadium, will the county or the Department of Health allow for tailgating in private lots?
It's a question that's hypothetical at this point. Right now, the odds are not great for fans, but there's a possibility. We'll consider it as we move forward. And there'll be all kinds of things. I know the Bills have a completely, even with returning to the stadium earlier this year, they had a plan which would limit a lot of activity. No tailgating. You could park, but you couldn't tailgate. No buses. So the buses that often like to come, there would have been no buses. So you would have to drive in with your car and get out of your car and go to the stadium. And that's assuming there would be fans. And with regards to private lots, we certainly, we understand that there's been an impact on the private lot owners. But right now, it's premature to even talk about whether we're going to have tailgating if we're not even certain we're going to have a game. Anybody I did not identify, B News, Western New York Media, or it was Channel 7 or WBFO? If not, we'll do
Hey,
one.
Mark.
Yes, who is this?
Allie Tui from Channel 7.
Hi, Allie. Go ahead.
Sorry, I didn't get to quick enough earlier. You got me?
Yes, go ahead.
Oh, great. Okay. So just in regards to fans in the stadium, I'm sorry to beat a dead horse here, but are you familiar with Don Arthur's proposal to test the ticket holders? Have you heard about his theory, his idea?
I will leave it at this. Yesterday, I announced that 60 people died from COVID in a very short period of time, and most of the questions have been associated with the bills. Let's get our priorities straight, folks. If there's no, I'll entertain another round of questions, but it's not going to be related to the bills.
Well, I'm just curious if testing has ever played a factor
There's,
in any kind of decision-making behind the scenes, whether they've indicated that testing would be important for ticket
we're
holders.
testing individuals who are sick or close contacts. I'm not going to waste tests just to see if somebody can go to a football game. There's only a certain number of tests that are being done on a weekly basis among the whole community. And I'm not going to waste thousands of tests so that people can go to a football game. Let's get our priorities straight. Everyone. We want our team to win. If we win the Super Bowl and we don't attend to any of the games, we won a Super Bowl. And trust me, as someone who lived through 4 straight Super Bowl losses and knows some of the former ex-Bills, they won a Super Bowl victory. And that's what we'll remember in the long run. Let's let Josh Allen and his teammates be healthy and get through this season. If we can get fans in the stadium, great. But our priority should be on reducing the number of cases and deaths in our communities. 60 people, I announced, died, unfortunately, in the last few days. And most of the questions have been about the bills. Get your priorities straight. We're done. Thanks, everyone. I hope you have a great day. I want to wish all our friends.
I have a Bill's question.
Certainly, any other media who has questions associated with non-bills, they can send them to us through our media, and we'll answer them otherwise. But it's Christmas time. We want to keep as many people alive as we possibly can so that we can get through this situation where COVID-19 is something we remember in the past. And we talk about the year that was the worst year of our lives in many ways, especially for those who lost a loved one. Let's focus on what is truly important during Christmas season. Being with each other, protecting each other in the future by protecting them now, so to speak. Being with your loved ones in your internal home, your family unit, knowing that the Christmas spirit of giving is protecting also. So let's protect the loved ones. Let's protect the people we don't even know who potentially are susceptible to very serious illness or dying from COVID-19. I wish all who celebrate a very Merry Christmas, and let's focus on what really matters in this season of giving, the season of loving, so to speak, of how we need to be better brothers and sisters keepers so that we can all enjoy these holidays in the future. Thank you, everyone. Merry Christmas, and God bless. Hopefully see you all in 2021, though we will have another report next week.